Hi, I'm Mayor Will O'Neill of the City of Newport Beach. Joining me today is Councilmember Diane Dixon, Marcy Brown, who is the Senior Vice President and Chief Hospital Operations Officer, and Dr. Michael Hurwitz, the Hogue Chief of Staff.
We're delighted to be here today with Dr. Hurwitz and Marcy Brown to get an update on COVID-19. This is our third video session. We're very pleased, and thank you, Hogue, for making your time available for us, because these videos, we post them on the city's website and you post them on your website. I think it's really a good community service, a communication service to the community, because Hogue is doing such a great job in treating our community members during this time of COVID. So let's jump right in. And the first question is to Dr. Hurwitz. How do Orange County COVID cases compare to the rest of the state? And what are you seeing at Hogue?
Well, first of all, I want to thank you for inviting us to speak, and I'm speaking on behalf of the medical staff. So we have been really very fortunate and honored to be able to take care of patients at Hogue. And Orange County certainly has seen its share of COVID patients. We're still not seeing the numbers that are being seen in Los Angeles County, but we certainly have had a sizable number of patients, as you know. So Hogue, early on during this crisis, really prepared well for this in terms of having available personnel, PPEs, personal protective equipment, ventilators, and so forth. So we were prepared early on. And as we've talked about before, we had the first patient in California with COVID-19. So we've had a lot of direction from our infection prevention team and so forth. So we're faring well now. We saw a significant spike over the last couple of weeks, and that followed Memorial Day, 4th of July, backyard barbecues, family gatherings, and everything else. And we're starting now to see those numbers flatten out and improve. Over the course of this whole thing, we've certainly had plenty of capacity for the patients that have come in with COVID and for all of our other patients. So we've learned how to deal with this crisis thus far. So we've been very happy and fortunate about it.
Dr. Hurwitz, I have a quick follow-up question. When you say you saw an increase, kind of a spike during that time period, were you seeing a particular age demographic coming in that you were noticing an increase of, and do you have any recommendations on how to convince that particular age demographic to do better, perhaps?
Well, it certainly looks like this latest surge in patients was of a younger demographic in the 30s, 40s, 50s, but we also had our share of patients from nursing facilities and older patients, so it was across the spectrum. Younger patients, of course, do a little better, and we've learned a lot about how to treat patients over this period of time, but they still get very sick, and it's not the flu, it's not a walk in the park. I have a couple of very close friends, one that I went to medical school with that is now recovering from COVID-19 in Arizona, and he said it was just the worst thing he's ever gone through. So it's not something that you want to subject yourself to if you can avoid it. Even though people are surviving, and the vast majority of people are surviving this. Really, it's essential, in my view, to wear a mask at all times when you're out in public. And we just can't overstate that. Probably best to not go out still, if you can avoid going out. But if you have to go to work, if you have to go to the store, then so be it. But wear a mask, wash your hands, don't touch your face. The same advice we've been giving people all along, and that still holds true. If we all wore a mask, we would really shut down this virus very quickly.
Yeah, I think one of the major differences I've heard in the community is a lot more people know people now who have gotten sick. And so I think that you're starting to see more of an awareness, more of a reality setting in. And one of the questions I've gotten, Marcy, is about testing. So a lot of people have asked, well, where can I get tested? So I guess that's the question. Where can people get tested, and what's the process looking like these days?
Well, testing has definitely been challenging for the community, and it continues to be a challenge. But at Hogue, we have set up testing for symptomatic patients. We're still not spending testing resources on asymptomatic folks in the community. But at all of our 13 urgent care locations, it's very, very simple. You can go online, make an appointment through our Clockwise system, and at any one of those 13 locations and be tested. And then at those centers, we call you with your results, whether they're normal or abnormal, and walk you through next steps related to your testing. But in most instances, when patients have symptoms, they're asked to self-quarantine, of course, in between that time period where they're swabbed and then they are given their test results. In addition to the testing capacity in the county and at our urgent cares, we're also offering serology testing to see if you have developed antibodies, if you believe you might have had the virus and are looking for those antibodies. So we're offering that as well.
Just a follow-up to that question, Marcy, we hear this nationally reported, more testing is out there and across the country. Is that creating the number of cases? I mean, there's a direct correlation, but the positivity of those cases and then subsequently the hospitalization of those cases is really the complete story.
Well, I would say what we're seeing is that in the majority of cases that we're detecting in our urgent care centers and some in the medical group, many of those patients are sent home and can convalesce at home. They self-quarantine, they take some Tylenol, they stay hydrated as if you would with the flu, and they're never hospitalized. So the cases we see in our emergency room are the sickest of the sick, and some of those patients are sent home, but some are hospitalized and need more invasive therapy and treatment. But I would say, I mean, we're still running collectively in all the testing we're doing throughout Hogue, about a 10%, I believe, positivity rate. Is that correct, Dr. Hurwitz? From
about that.
All the testing, from the numbers that we are seeing.
Well, and Doctor, just speaking about people in the emergency rooms, we talked when we did our last video several weeks ago about the importance for people in the community to seek medical attention. Are you seeing your hospital bed capacity filling up or increasing, not taking beds away from COVID patients certainly, but for people who need medical care, are they seeking medical care?
Well, it's really important that we recognize that COVID patients aren't taking beds away from everybody else. So about 7% of our hospital beds now have COVID patients. So we've got plenty of capacity for patients with other conditions. And as we said then, the same holds now. If somebody is having concerns with heart problems, stroke, abdominal pain, all the usual things that bring people to emergency rooms, there's no reason not to go. The emergency room is safe, you'll be well attended to, you'll get excellent care, so we have the capacity to take care of patients with other problems, and they shouldn't let fear of this virus keep them out of the emergency room or prevent them from getting the care they need. I just can't overstate that.
And so you are seeing more patients come in, non-COVID related patients?
You know, initially we saw, the numbers really dropped, and I think a lot of that was because of fear and uncertainty. And I think the longer this goes on, the longer that we live with this, I think people are clearly coming out, whether it's coming out to socialize or coming out to get medical care. So people are emerging and getting the care they need. I don't have data to suggest that they're not seeking care.
Yeah, I mean, so when we came in today, one of the things that we got to do is we had our temperature checked. We're obviously wearing face masks, which is different than the last time we were here. Right. And so I'm curious, Marcy, what is Hogue, other than those two things, what is Hogue doing to make sure that their patients are not only feeling safe, but are actually safe, and the same thing for visitors?
Well, I'm so proud of Hogue and all of the tactics and things we have done to make sure that when our community seeks care, that it's in a safe environment. So we have sanitizing techs that are throughout our facilities, making sure that they've sanitized all those surfaces on a regular basis. That's their job. That's their full-time job, is to make sure that they're wiping down those surfaces and keeping our facilities clean. We're also distancing out our appointments so that we don't have any stacking effect in our waiting rooms. We're also offering a service where if you would rather wait in your car and shoot us a text message or a phone call to go straight to the exam room rather than wait in the waiting room, you're free to do that as well. Yeah, in addition to all the things that most offices are doing in temperature screening and those type of safety checks and symptom screening, we've added those additional layers to just make sure that the public feels safe and our staff feel safe as well.
Sure. Shifting gears to the future of treatment or vaccines, Hogue is doing this, or Dr. Hurwitz. Hogue has, we talked about this the last video, has been involved in clinical trials. Can you update us on the clinical trials, and what is our projection, our hope for the short-term future?
So one of the big medications that's come out of this has been remdesivir. So we early on participated in remdesivir trials. And now we have remdesivir available for our patients. There's also a trial going on with remdesivir and a drug called tocilizumab, known as TOSI for short. And that's an antibody to an IL-6 receptor, which is thought to trigger something called a cytokine storm. So one of the problems that we've seen with COVID-19 is this ramped up inflammatory response caused by an overactive immune system triggered by this virus. And that's called a cytokine storm. So this tocilizumab is being investigated as a drug to stop that process. And so we're involved in a clinical trial of that with remdesivir. We also have clinical trials with convalescent plasma. This is plasma taken from patients who have recovered from the virus. And that's showing some promise as well, and that's in widespread use in many places, and so we're happy to have that as well. Vaccine trials, I'm sure, will follow. As vaccines are released, we will participate in vaccine trials.
You want to hazard a projection of when we'll see a vaccine?
You know, you don't want to be overly optimistic, but everything that I've read suggests that sometime in early 2021 the vaccines will be available. They may be released sooner than that. Some companies are saying as early as September or as early as December, but there's a lot of steps they then have to go through to be approved and manufactured and so forth. So the best estimates seem to be around the beginning of the year.
But it does look like we could have one or more vaccines, I mean, on some timeline in the next few months.
Well, there's a lot of companies that are working on this. Mm-hmm. This is a big business, and people are very excited about that. There's a couple of trials that we've been hearing about. This company Moderna has a vaccine in preparation, and there's this Oxford vaccine that we've been hearing about in partnership with AstraZeneca. So both of those they're competing against each other. They're really firing up to deliver vaccines. Pfizer has a trial, Johnson & Johnson has a trial. There's a lot of companies that are throwing resources into this. So it's hard to imagine that we won't have a vaccine. We still don't know how long the vaccine will last. It may be that 2 doses are required, or 2 shots, some 30 days apart or so. So we don't know exactly the form that it's going to be in, but we're hopeful that we'll have it.
Well, it's like a flu shot. You need one every year, whatever the variation is.
Right, and in this case, you might need 2 shots every year, or, who knows exactly.
Well, knock on wood, let's hope we're getting there soon.
Can I just make one more comment, Mayor, about your question about patients receiving safe care at Hogue and those actions that we've taken to do that. I think it's important for the public to know that even in our emergency room, if you're having chest pain or symptoms of a stroke and you're needing to access care, our teams in both Hogue Hospital Newport Beach and Hogue Hospital Irvine, we have triage and a way of cohorting those patients that we deem to be having symptoms of COVID. We immediately cohort those patients until their rapid test is performed and they're deemed either clear or indeed COVID positive. And then if they are admitted and put up on one of our units, they are put on a COVID cohort unit. So I don't want the public to get the perception that if you're coming to have a baby at Hogue or you're coming to have heart surgery at Hogue, that you could potentially have a COVID positive patient in the room next to you. We've been doing that since COVID hit our community, and that has proven to be a really safe strategy in making sure that the staff and the physicians and the patients are best cared for in that environment.
Well, and going beyond that, actually, my understanding is that, I mean, the last time we were doing this interview, you hadn't yet started the elective surgeries. But my understanding is now you've been doing a lot of elective surgeries, and you test the patients before they come in for an elective surgery. And I've also been hearing anecdotally that there are people coming in, finding out they have COVID. They were asymptomatic, didn't even realize it, but because they were coming in for an elective surgery, they tested positive. What's been your experience, doctor?
So we've had a handful of patients that have tested positive in advance of surgery. It's been very important to do that, to know if somebody's got this virus before surgery. And obviously, if they are having an elective procedure, we don't want to operate on them if they have COVID. But knowing that certainly protects the patients and protects the healthcare team that's taking care of them. I think what we're going to see ultimately is that the number of patients with asymptomatic COVID coming in for elective procedures reflects the prevalence of COVID in the community. And right now that's somewhere in the order of about 1.5% of the population. So I think we're going to see more of that as that prevalence increases.
Well, and so talking about the community, Marcy, I mean, what is Hogue's message out into the community to bring people alongside, to partner with Hogue, to continue to advance that message of stay healthy,
Right.
Basically
Stay the course.
Yeah, stay the course.
Yes,
Exactly.
right. I think now is not the time to be complacent. Now is the time to double down on our efforts of, like Dr. Hurwitz said, masking, washing your hands, not touching your face, and social distancing. It's not one or the other. Some people I talk to out in the community think, well, I can choose. If I wear a mask, then I can go to the family gathering or the barbecue. If I socially distance, then I don't have to wear the mask, right? It's not a choice of one or the other. It's all of the above. And then also the part about complacency, it's so important that we don't cave into that desire to have that family barbecue, to celebrate the graduation by having grandparents and aunts and uncles come together if they're not already living in a cohort, together in a home. Those things are so tempting right now because everyone's craving that social interaction and that wanting to just be with family and friends. But we've got to really stay the course. And it's frustrating to our physicians and caregivers that are seeing these patients so sick in the emergency room and coming into access care. But then they go home in the evening and go to grab groceries at the store or go down for a walk, and they see people not following the guidelines. So from our team to the community, our ask is that we stay the course, and we are in this together, truly.
Well, I was just going to follow up one more, and then we'll wrap up. But our community is unique, and this is the added challenge to your good comments to keep us all safe. We have tens of thousands of people who come to our community.
Right.
For the beach, just for tourism, visitors.
Yes.
And there's no way to close off the community or to keep people off the beaches.
Right.
Even when we close the beach,
Yeah.
people are coming to the beach. So it's a real challenge, and so your message is so important for people to take personal responsibility and wear the mask, wash your hands, and keep socially distanced, because that's the best anybody can do.
You're absolutely right. Yep.
And I would add, wearing a mask might give us a little bit of protection, but really we are protecting one another. So my mask is protecting you from me in the event that I'm an asymptomatic carrier. And this only works if that civic responsibility, that shared participation in that is reciprocated. So if the person you're talking to isn't wearing a mask, it's not doing any good. So we need to all protect each other, and that's part of, as I see it, being a citizen. That's just part of our social contract that we have with one another. And it's really important that people participate. So I just encourage everybody to wear masks whenever they're out in public, even if you think it's silly or there's nobody around.
And we'll get through it. I mean, this is the
That's
way
right.
to get through this.
That's absolutely
this
right.
challenging period.
Mm-hmm.
Well, we, at a recent city council meeting, we passed a resolution on behalf of the city of Newport Beach thanking Hogue and all of your staff for all of the work that you're doing as a partner in our health community. And then you recently named your 2020 Nurse of the Year, which I'm sure she would love to come together and have a huge celebration, but it's not that year.
Right.
So on behalf of the city of Newport Beach, if you wouldn't mind giving this to her, Susie Elmore received the Nurse of the Year award, and so this is a proclamation congratulating her. And on behalf of the city of Newport Beach, I just want to say thank you to all of our nurses and all of our doctors and everyone at Hogue Hospital for partnering with us. So thank you for doing this, and thank you for everything that you're doing day in,
Thank you,
day out.
Mayor. Thank you so much, Mayor.
Thank you. We are so
City
grateful
Council
for what
member.
you're
Thank
doing.
you so
Thank you
much.
so
And we will
much.
get this to her. She will be so proud. She's well deserving, and she is a proud citizen of Newport Beach, and so fortunate that she's on the Hogue team. So
Well,
Dr. Hurwitz and I will get this to her.
And
We
I
are
can
so
say,
proud
having
of
worked-
Hogue. We
I've
are so
worked with
proud of
Susie,
Hogue. Our community is so
for
proud.
so long. She's terrific. She's a great nurse. She cares so much about her patients. And so do all the nurses that work with Susie. I've worked with her many times with many patients on the 6th floor of Hogue Hospital, and you know, they're all terrific.
We are proud of Hogue. So thank you for all that you do. We are so proud.
Well, I can't imagine living anywhere else because of Hogue. Honestly,
We are
I've worked
so
other
fortunate.
places and lived other places. I'll never leave this community because of Hogue and the beautiful city we live in.
Well, thank you for all you do.
Thank
Thank
you.
you. Thank you. Thank you.